Hello, my name's Jason. I'm a physical therapist with the Main Strong Balance Center in Scarborough, Maine. And typically when I'm doing a video, I'm talking about balance, which is something that we treat here all day long. But today I want to talk a little bit about back pain. And the reason being is the pandemic has changed so much, as you can see. And with those changes, the result has been we've seen an increased frequency in people accessing our services because they're in pain in their back. And here's a common formula that I'm seeing. What we're noticing is that people are getting into more projects around their house, especially outdoor projects as an example. So they may be doing shorter bouts of high physical activity that they're not used to. You combine that with people are being a little more sedentary. So a lot of folks are communicating to me that they're spending more time on their computer or reading, and they're just not as active as they were. So they may be sort of doing more work, but maybe a little bit less active. And the third sort of piece of it is exercise. A really good exercise program can be really protective for back pain. It can keep you safe. But a lot of folks are separated from their usual routines, and it's hard to get our footing in terms of the new realities that we're dealing with. So I think that's the perfect storm that sort of resulted in an increase in back pain that we're seeing around the clinic. So I want to take a minute to share a couple common exercises that we use to treat back pain. I think what's really important to communicate is there's not a one-size-fits-all answer to this, meaning, it really depends on what the origin of the pain is in terms of what treatments are going to work best. That being said, these are really frequent exercises that we use, and I thought it could be a tool or an opportunity to share what we know with you. It's always a good idea to talk with your doctor before you start a new exercise routine, especially if you're unsure how it's going to affect your back. And physical therapists, here at the clinic, we're ready to provide telehealth, and we do that every day. Physical therapists around the state are doing the same thing. So consider using us to help you, and that's really our specialty, coming up with programs that can help you with your individual needs. That being said, let's get into some of these exercises. So the first exercise I wanted to share is called a bridge. A bridge is an exercise where you're going to strengthen your buttock and your low back. This is what it looks like. So you need a firm surface. A bed will work fine. If you are able to get up or down from the floor, you could certainly do that on the floor with a yoga mat as an example. And a bridge is when you're lifting your hips off the table until they're in line with your body. Okay, I'll show you again here. So starting with your hips on the table, and then lifting up. If it's pretty easy to do this may be a really good starting point, just sort of lifting up and down. If it's easy, the next step would be to hold the bridge. So maybe holding it for a 5 or a 10 count. And that's not so easy. And now if that were easy, the next step would be to try to maybe lift one leg at a time while you're doing the bridge. So you can really customize the bridge to sort of meet you where you are. What's really important from a strengthening standpoint is to pick a form that you can do with good form, or pick a level that you can do with good form. There's no sense doing one that's too hard, because that could actually cause injury as opposed to help with it. And strength is really important from a protective standpoint. So again, if you're strong in that midsection, it can just sort of really support the spine. In terms of how many reps to do, that really depends on how you're doing. The literature on strengthening communicates to us that basically if you're working somewhat hard, meaning if it's not really easy and it's not a struggle, that would be adequate for making strength gains. So pick a position that's going to work for you, do as many as you can so that it's somewhat hard, and then you can move on to the next exercise. The next exercise is called the bird dog exercise. So for this exercise, you're going to be on your hands and knees. As you're on your hands and knees, it's really important to consider your back position. A lot of folks will start out with their back too arched, and that's really not where you want to be. You want to sort of tighten your tummy and keep your back flat so that you're really engaging the core. And then what you're going to do from this position is you're going to lift an arm and a leg, keeping that midsection tight, then bring your hand to your knee, and then extend. This one's really pretty difficult. If you're having trouble with that exercise, you could start with just doing a hand or just doing a leg. And if you get the hang of this exercise and you're ready for sort of the next level will be doing one side at a time, which is really tough. So I'm going to do just my left side here. All right, and I'm really working to sort of stabilize through my midsection to do that. All right, same parameters as the bridge. To get stronger, you basically got to repeat something that's somewhat hard to do and pick the level that works for you. The last exercise I'm going to share is a stretch. Stretching is really important for back pain. Here's an example of why it's so important. If you have tightness in the front of the hips, which is something I see a lot, basically these muscles in the front of the hips, a lot of them originate, well, one of them in particular originates from the low back and comes down to the femur or the thigh. And if it's tight, it can pull you like this. Now obviously that's not a good position for the back, so if we can get more flexibility in the front of the thigh, you can be up a little more neutral. And a neutral posture is a really positive thing for the back, and a lot of times that can be helpful in treating pain. So a stretch that we really like for the low back, if there is tightness in the hip flexors in the front of the thigh, is a position where you're hanging one leg off the table. So this one would work best on the bed. So I'm going to use my mat, and what I've got is I've got one leg up on the mat, my hip or my buttock is just on the side of the mat, and my leg is dangling off the table, and I'm getting a stretch in the front of the thigh. For a stretch, the best thing to do is to just hold that position. It's what we call low load, long duration is the best medicine. So for a stretch like that, I'd recommend you hold it about 90 seconds. I hope you find these tips helpful. Thanks for watching our video, and good luck out there.